Okay, here we go. This is the DeltaWrap description of how to apply it and showing you how to install it in a fairly quick and easy manner. You can put it on a daily basis as night or whenever you feel like you have the need for it. While you place your foot in the boot part like you see here, in the middle there's a seam, and then you take the additional part with the pink side up and place the narrow part under your foot to some degree, not all the way, and make sure when you wrap it around the front of your foot that it goes up like 3-4 inches up on your past the joint of your foot. Then you take the strap, the Velcro strap with elastic, and apply it to the middle of that foot pad overlay. Then you do the same thing to your calf leg part, and make sure when you overlap them that you kind of keep them tight together, like you see here, putting a little bit pressure on and then pulling it over, and make sure to attach one of those hook straps. Then you just continue on by adding more and more along the seam, and you can feel how slight pressure is building up. Then you continue also with the foot part as well, and reattach that one because of the seam on the bottom doesn't receive the hooks, so you might have to replace one or the other, or not replace but reposition, and make sure that you cover the whole leg with these elastic straps so that there's the whole seam is neatly covered. This will ensure that the pressure is evenly distributed over the whole boot. And also, not to forget, you can use one which you will see here in a second to also put a little bit pressure on the toes so that they don't get forgotten. The main objective of doing all this is to actually cause swelling to go back. The pressure that we are applying here is above the lymph system pressure but below the blood pressure. With applying this light pressure, it allows the lymph system to drain, and make sure you drink a lot of water. And then with the draining of the lymph system, it opens up the blood vessels, or with the swelling going away. This is the upper sleeve, which is a straight one with a wider part which goes to the top, and the lower part is the less wide area. The seam goes like on the back side of your leg, and you do the same procedure as before. Overlap them and use one of the strips, pull them to length, the elastic, and attach it. Then just continue on and sew the whole thing together. Make sure again that the whole seam gets worked, and that you have like a 2-inch overlap, what you could see there, and make sure that once you're done that you don't keep or put 2 straps on top of each other between the layers. So I'm removing that one on the bottom and applying it to the top layer now, which will do the same work as below, but then we don't double up. Make sure that none of those elastic straps gets in between and puts pressure directly onto your skin or tissue. Yeah, just keep going and sewing this puppy together. by now it should actually feel very comfortable. If you had any pain, most likely that pain was caused by swelling, and that swelling, since it is dissipating, the pain will actually almost immediately go away. So there's many benefits to this whole thing, and you can see here it's now top to bottom, everything nicely wrapped up. You can walk in it, you can sit in it. Actually, I'm wearing it right now while I'm talking. And yeah, bend the knee. You can see here, no problem with bending the knee. It could become uncomfortable after a while if you have the knee sharply bent on the back side. It might become uncomfortable, but you will notice. So that's about it. Let me know if you have any questions. That's all for now. Thank you.